And when you're put in that situation where cancer has happened and you feel like anything is possible, it literally was driving me insane. It literally occupied my life. I could barely sleep because of the anxiety and paranoia. So I guess the way that I sort of dealt with that specifically was by seeing a counsellor. There was like a specific young people's cancer counsellor on our ward. They got me to talk to her. At first, I was very resistant to it. I was like, no, I don't need to chat to anyone. I'm completely fine. But they said, no, just like a general nice chat. And it was actually really, really good for me because all of the sort of pent up emotions I've been holding in, I didn't really want to tell my parents because I didn't want to upset or scare them. I was able to tell my counsellor, which was really beneficial for me.
How are you doing?
Yeah, I'm good, thank you.
Awesome. I'm great too.
Good.
Okay, welcome to the VoCP Talks, a platform to empower the cancer community. Our guest speaker today is Ellie Waters. She's a rhabdomyosarcoma warrior and a childhood cancer advocate.
Yeah.
Ellie has tried to educate and spread awareness about the side effects of cancer treatment in children. And she's also written a booklet called A Young Woman's Guide to Menopause After Treatment for Cancer, along with Dr. Louise Newson. Welcome to the call, Ellie. We have a couple of questions lined up for you. We'd love to get your insight on them.
Yep.
Awesome. Okay. Treatments and surgeries that children with cancer go through lead to long-term side effects, such as infertility and early menopause. So, can you tell us how these affect the long-term well-being of children as well?
Well, yeah, it definitely has a massive impact on children and young adults. These treatments that we're given are so harsh and so toxic on such like growing bodies, and we're such vulnerable bodies because it's at a time when we're growing, and it can have like a massive impact. And I read a statistic somewhere that 95% of children who have had treatment for cancer will have a long-term side effect, at least one. That's quite, a massive proportion of children who have to go through the treatment. And it has a massive impact on your mental well-being because, you know, once you finish the treatment, you may look normal, your hair grows back, you look healthier, but you're still left with the burden of all the side effects from the treatment that you had to have to save your life. So it is really difficult because it's trying to navigate normal life again, but in a different way because you do feel different. For a long time, and still now, actually, I still feel a lot different to everyone around me because I'm carrying this extra baggage with the infertility, the menopause. Every time I eat, I have to take medication now. So it just goes to show how cancer treatment can literally, you know, remold your life massively. And it can have a massive impact because, especially with the infertility, now you're having to adjust the way that you even have children in the future. So it is really hard and can be very mentally damaging for the children and young people who have to go through it.
Sure. Thank you. Thank you for your insight. Also, I wanted to ask you regarding a hashtag that you use. So there's hashtag recognize me. You use that to spread awareness about rare childhood cancers and the lack of funding in cancer research. So, like, how did you start this movement? Could you tell us a little more about it?
Yeah, actually, that's like brought me back because that was like a couple years ago now that I did that. But for a childhood cancer awareness month, like it must have been about 2 or 3 years ago now. September is childhood cancer awareness month, and I basically did this sort of movement called Recognize Me because I feel like a lot of people don't realize that children and young people can even get cancer, and not only that,
Mhm.
that blood cancer. The amount of times that I've been asked, "Oh yeah, did you have leukemia?" Because that actually is the highest proportion of cancers in young people. But no, I didn't, and I just wanted to sort of promote the rarer cancers as well, like my cancer, alveolar rhabdomyosarcoma. At least in the UK, there's only 60 children a year who get that cancer. So
Okay.
it's rare, and because of that, the treatments are very outdated. So I don't think the treatment for rhabdomyosarcoma has been changed in a few decades because, if there's so little so few people getting it, they don't see it as necessary to put the funding into. So there definitely hasn't been as many advancements as, let's say, treatment for leukemia. So I guess that's why I did the Recognise Me campaign, just to make people aware that young people can get rare cancers, and it does have a massive impact on their life because they're usually having to have really, really aggressive treatments that will leave them with side effects, and treatments that might not even cure them. They may relapse, and then once you relapse, the treatment options are even more limited. So it is really difficult.
Yes, I think someone's saying even their son has it. It's 500 in the US, so there haven't been advancements since 70s. But yeah,
Yeah.
that's pretty tragic to sort of see lack of funding in terms of cancer research. And the mental health issues obviously are very draining, like you said. Could you talk about your experience and your journey overcoming that?
Yeah, so when I was actually on treatment, I suffered with a lot of anxiety, especially with the feeding tube. So I think, especially when you're diagnosed with cancer, you think anything is possible. Like I convinced myself, I had like a mad level of paranoia. Like all the time, I was convinced I was going to get like a blood clot, or I was just going to suddenly collapse and die, or anything. Like I just believed that because I got like a 1 in a million cancer. Like anything else seemed possible to me. So what I latched onto on treatment, became very obsessive about, was my feeding tube. So I had to have a feeding tube because I wasn't able to eat enough to sustain my weight. And they always tell you that you have to draw up some of like your stomach contents with the NG tube and test it on a pH strip. If it's within the right normal ranges of pH, then that shows that the feeding tube is in your stomach and like not in your lung. And I became very obsessed with it. I was like, oh my gosh, imagine if this is in my lung. What if I'm dry drowning and I don't even realize? Which is completely, absolutely ludicrous, because if you had fluid going into your lung, you definitely would feel it. You'd be coughing. You'd be able to feel if a feeding tube was in your lung. But no matter what any doctor, any nurse, anyone said, I completely believed it. So I would, I find it difficult to sleep at night. I was convinced that I was going to dry drown in my sleep. I would like have almost like panic attacks where I couldn't breathe properly because, it's like mind over matter, isn't it? And when you're put in that situation where cancer has happened and you feel like anything is possible, it literally was driving me insane. It literally occupied my life. I could barely sleep because of the anxiety and paranoia. So I guess the way that I sort of dealt with that specifically was by seeing a counsellor. There was like a specific young people's cancer counsellor on our ward. They got me to talk to her. At first, I was very resistant to it. I was like, no, I don't need to chat to anyone. I'm completely fine. But they said, no, just like a general nice chat. And it was actually really, really good for me because all of the sort of pent up emotions I've been holding in, I didn't really want to tell my parents because I didn't want to upset or scare them. I was able to tell my counsellor, which was really beneficial for me. Yeah, so I feel like, and when I got into remission, my mental health improved a little bit because felt a lot healthier. I was able to go back to school. I felt a little bit more normal. I felt very different to my peers. Like it was around the time, like 17, 18 years old, where all my school friends were getting boyfriends. They were getting jobs, trying all new things, but I was just so, so tired all the time. I was very irritable. I had no interest in having a boyfriend whatsoever, and was convinced I was going to be a single cat lady for the rest of my life. That's how bad it was. And yeah, it just turns out that basically went into the menopause. I already knew pretty early in remission that I was going into the menopause, but the HRT, so the hormone replacement therapy they gave me, was too low. It was too low dose for me. I didn't realize that. They didn't realize that. Um, so I ended up getting all these terrible menopausal symptoms, which just made me feel a lot worse. I felt like such an outsider compared to my peers. I constantly felt like the odd one out. I didn't feel like a proper woman at all because not only was I infertile, now I had the menopause. I was very small, very skinny as well, because I was still struggling to gain weight from the treatment. So I didn't feel womanly, I didn't feel attractive, and that had a massive impact on my mental health, my body image, how I saw my body. Because it's funny enough, when I was actually on treatment, I didn't care that I was bald. I showed it off to people. I was like, yeah, I don't know, that's so great, sort of thing. But as soon as, within a few years of remission, my hair grew back, I looked healthier, but actually my body image and self-confidence was worse than it ever had been. I think it's because I was more normal. I looked more normal now, so I compared myself to my peers a lot. I couldn't really compare myself. I had to give myself some slack because, I've been through a lot. I've been through 18 months of chemotherapy. My peers hadn't. So that was difficult, really difficult to deal with for me.
Mhm. All right, thank you. I think this might have been a little personal as well. Okay. You also talk about early diagnosis of cancer and how important it is for proper treatment and increasing the survival rate. So, how do you think early diagnosis can be facilitated?
I think just promoting the fact that, yeah, children and young people can be diagnosed with cancer. Because I know when I felt my lump and it was growing, it wasn't very painful, it was just uncomfortable. It didn't even cross my mind that it could be cancer, because it's not that I was unaware that children could get cancer. I just knew it was so rare that I didn't think it was even a possibility. So I think just promoting more, maybe within schools, within education, the signs of cancer, and just also promoting that if you feel anything different about your body, then tell someone. Because my initial primary tumor was in my left butt cheek, I was not prepared to tell anybody about that, which was a real shame. But I didn't feel comfortable to tell my parents. I didn't want to tell a doctor. I was so embarrassed that I just basically sat on it and let it grow until it got to a point where I literally couldn't hide it anymore, because I was so constipated, couldn't even urinate properly, had so much pain. So I think just promoting and advocating that if you do have a change in your body, make sure you tell someone, tell a doctor about it. And then I've noticed recently, I don't know if you're familiar with the Teenage Cancer Trust. It's a
Mhm.
charity in the UK who help teenagers with cancer. And actually, I've noticed that outside some colleges now, they have posters with the signs and symptoms of cancer on them. So I think that's good, just to make young people aware. Have it somewhere where loads of young people are, obviously at a college or university, and I think that's really useful as well.
Yeah, I think that's a great idea. Maybe a little more campaigns and posters would probably help. Awesome. And do you believe that there are certain cancer treatments, related issues that are not solved very well because people are reluctant to speak about them? For example, early menopause and its symptoms.
I would agree with that. Yeah, I think there's definitely major setbacks because of that. When I actually first got diagnosed as being menopausal, I actually couldn't find anything online about being a young woman with the menopause. It was almost as if it didn't exist. So I genuinely felt like I was the only teenager in the world who was going through the menopause, which obviously wasn't the case. But there just wasn't that awareness there. There wasn't even really many Facebook groups or sites about it. And I was also, in a way, and negligently really made to believe that the menopause wasn't a real issue. My doctor said, "Oh, you got the menopause. We're going to give you this tablet. You'll be fine." But they didn't tell me all the other problems that can occur with the menopause. All I was aware of was that if you went through the menopause, it meant that you got no periods. I didn't realize that it could damage your bones so much that you could go and get osteoporosis. I didn't realize it gave you like fatigue, pain, all these extra things that come along with the menopause. So I assumed that those side effects were all long-term side effects of my treatment, that I was just had to sort of deal with. But then when I found out that I could actually make it better by going on estrogen and more estrogen, then that was really good, and it was a good turning point. And I feel like the reason this is so held back and so set back really is because people don't talk about it. I think after treatment, you're sort of conditioned to think that, oh, you're so lucky that you're alive that you shouldn't complain about anything. Or at least that's how I felt. I felt like if I didn't feel a lump or any pain or anything, then I shouldn't complain. Like, I should just be lucky that I survived the cancer with whatever baggage it has left me. But that's not the case, because you're the one who has to live in your body for the rest of your life. So if you have any issues, and with the menopause, it can be quite easily treated with hormones as well. And I know a lot of people who had a lot of vaginal problems after like radiotherapy, and they found they couldn't speak to their doctors about that, and then that leads to loads of problems in itself as well.
Awesome. Okay. All right. And can you tell us how the diagnosis and the treatment affected your regular life, for example, including schooling, and how did you get back to it post-treatment? So, what would be your tips for someone who might have to take a break from school due to treatments?
Okay, so when I was diagnosed, I was like in hospital for a full month. So I completely missed all that schooling. And then with my 9 months of intensive chemotherapy I had to miss all of school in that as well, because I was too ill. I was neutropenic, so I basically had no immune system. I was really weak, really tired. So for my health, I had to literally not go to school for a good, I think I wasn't at school for 7 months. And if you're that unwell, then you just got to do what you got to do. I did get set work to do at home, and I did have a weekly tutor, but I found it hard. Even doing work at home, I didn't have the concentration because of like the chemo. I was just so tired all the time, so exhausted. So I basically took that as like a little year out. So I got diagnosed in the September, and I didn't go back to school until April time. So it was safer for me to stay at home. I did have a weekly tutor, but it didn't really benefit me very much because I was just genuinely too tired to really even engage in what she was teaching me. And then when I went onto my maintenance chemo, which is like a less harsh form of chemo that I was on for a year, I did go back to school, but on a part-time basis. And that was good. I really enjoyed getting that sort of normality back in my life. I did actually decide to repeat that school year because I missed so much, so I didn't have to catch up. So that was a bit difficult at first, because I guess no one wanted to talk to me very, very much, because I was just known as the cancer kid, and they're a little bit scared that they would say something wrong. But I soon made friends, which was nice. And then as soon as I finished treatment, I pretty much went straight back into full-time education from then on. Obviously, with the chronic fatigue and chronic pain, it was difficult at first, but I did soon get used to it.
Um, all right. Currently, you're enrolled as a medical student. So, what motivated
Yeah.
you to pursue this field, and what do you hope to specialize in the future?
So I'm really enjoying it at medical school. It's really, really fun. And I hope to specialize in, at the moment, obstetrics and gynecology. Because I'm really obsessed with any of like the baby programs, like giving birth. I find it so fascinating that a woman can literally grow like a tiny little human inside her. And I think because I'm infertile and can carry my own kids anyways, it'd be nice to like almost live that experience through other people and help people with that. Um, and yeah, I think just women's health is so fascinating. So I think that's definitely what I would like to go into.
Okay. And one of the most difficult obstacles on your road to recovery and remission is gaining weight. So, what are some of the other common obstacles, and how do you face them? Like, what kind of a support system do you have to fall back to?
So yeah, as you said, gaining weight, I found that really difficult in remission, because I had the feeding tube for so long, I wasn't used to eating properly. And because of the radiotherapy, I had a lot of digestive problems, like I wasn't absorbing my food properly. So that's actually why now every time I eat food, I have to actually take a tablet that helps break it down to absorb the food better. So that's like a sort of, lifestyle change that I've had to adapt to, like bringing medication with me everywhere. And then in terms of other side effects, with the chronic pain, chronic fatigue, you sort of have to resign yourself to the fact that you probably can't do as much as you did before. I remember I used to always be on the go. I'd do school, I'd go for a run after school, I'd go and see my friends. I had so much energy. And now, like if I have like a few busy days, I feel the effects of it for a few days after. So I think it's just what I always say to people is working within your limitations and not against them. I used to always try and push myself further, and try and, I was in denial about my chronic pain and like chronic fatigue that I had, try and act like I was normal again. I could, go for walks, go for runs, but, ultimately I'd be worse off for it because I would end up being so exhausted that I couldn't do anything for a few days. So I felt like actually let's work within my limitations, make sure that I pace myself a bit, and look after myself, instead of just trying to push myself to do everything I possibly can. Not sustainable.
Okay. All right. And you wrote the booklet, A Young Woman's Guide to Menopause After Treatment for Cancer, along with Dr. Louise. How was your experience writing it, since it was from personal experience, and what were the motivating factors behind it?
So I was really, really passionate to make this booklet with Dr. Louise because when I was diagnosed as being menopausal, there was nothing out there like it. I didn't know where to go to for advice. There's an amazing organization called the Daisy Network, and they give advice for young women who'd undergone, the menopause, so that you didn't have to go through so many different avenues to get the right help that you needed. So it was all in the booklet so that they could use that to empower themselves to speak to their doctors to get the right HRT regimen if HRT is what they want. Because I think especially with the menopause, you've got to be your own advocate. You know your body best, and there's so many different types of hormone replacement therapy, so many different types of regimes for it, that you need to sort of figure out within yourself what may work for you, whether you'd prefer a gel, a patch, do you want to use testosterone as well, and then empower yourself with the knowledge that you can inform your doctor rather than them informing you, because you know your body best. So I wanted it to be really informative, but also be really personable, something that young women going through it could relate to, and something that they could easily look at if they needed any tips, advice, or information.
Got it. Okay. And in one of your posts, you've said that cancer has normalized death for you, and you pointed out this sad reality as something to do with the underfunding of cancer research. So, could you talk us through the current scenario of cancer research?
To be honest, I won't lie to you, I've been a bit lazy recently. I haven't really kept up with it. I've just been so busy. So I don't know really what's going on in the world of especially childhood cancer research. I think there's a lot more going on, now about like using immunotherapies, which seems quite promising at the moment. But in regards to new chemotherapy drugs, I actually don't know. But one thing that is quite good that's been quite recent actually is, the late effects clinics. So just recently, I got referred to a late effects clinic, which actually has been so good because it's just a little clinic with a few like healthcare professionals, and any long-term side effects or problems that you have, they're able to deal with it really quick and able to help you. Whereas I found that if I went to my oncologist with any problems, it'd take them a lot longer because they had loads of patients to deal with and patients that were like critically ill. So it wasn't like on top of their priority list. Whereas having like a late effects clinic where you can like properly like in depth talk about the problems that you're dealing with, how to make them better, I think that's been like a remarkable sort of thing that's happened recently. And it just shows that you shouldn't have to deal with these problems alone.
Got it. Okay. We have a quick question from the audience.
Yeah.
How do you get over peer pressure while in cancer? It's difficult to talk about cancer. He's afraid that people would call him names. Okay. So, how do you get over peer pressure while you're in cancer?
I don't know. It's hard really because, when I actually went back to school, there was some people who like were a bit mean to me and said that because I had the social media page, like the cancer page, they said that I was like using cancer for attention, or I was milking it, or like I actually wasn't as ill as I said I was, that sort of thing. And like my school actually raised money for me to go on holiday with my family, and there were some people who refused to take part in that like fundraising event because they said, well, she's just got cancer, like she's not going to die. But there was a possibility that I could have. So I did get some negative sort of comments and negativity from people. And I had a few friends who actually stopped being my friend because they just couldn't handle it. They're like, oh, I can't handle that my friend has got cancer, they have to go to the hospital, I don't want to know, sort of thing. So it is difficult. You expect when someone gets diagnosed with cancer, you expect everyone to be nice, and like really empathetic, but not everybody is.
Thank you so much for your time, Ellie. It was a pleasure talking to you. I'm pretty sure that a lot of people have been inspired by you in their cancer journey as well, and also to become allies. I think that was something that people could take away also.
Yeah.
Thank you so much.
Well, thank you very much for having me, and thank you everyone for watching.